kind of scratching my head thinking COPD. Don't know. But it kind of sounds like something I might have heard before.
COPD. No, none at all.
I've no idea what COPD is. Are you going to tell me what it is?
Got no idea. What is it?
COPD stands for chronic obstructive pulmonary disease, and it's a disease that affects the breathing tubes to the lung and also the air sacs to the lung, and it causes chronic bronchitis and emphysema. This is a very common condition. For example, we know that in the UK there are 900,000 diagnosed cases, but we calculate there are 2.8 million people with this condition, and the discrepancy is because so many people who are current or ex-smokers have the condition, but they don't realise it, and the British Lung Foundation is mounting a campaign to find these missing millions, and we are lung function testing people all over the country with great success. We're finding a considerable percentage of people who hitherto had no idea they've got lung disease, who have abnormal lung function. COPD is predominantly a condition caused by smoking.
I gave up smoking 7 years ago, and 6 months after that I was diagnosed with COPD, although the problems have been there for some time before that, obviously.
One of the problems with the lungs is they have an enormous amount of reserve capacity. So if you are a smoker and you are at risk of getting COPD, by the time the condition presents in day-to-day life by cough and phlegm and breathlessness, it can be quite advanced. If, however, you're very fit and you do a lot of running and exercise, you may notice it earlier because you test your lungs more. If you suspect as an individual you might have COPD, there are both symptoms you can look out for and there are tests you can have done to see if you have lung disease or not.
Well, my health's quite good actually. I had no real reason to be concerned. I'm not a smoker, but I was passing by and they're offering lung tests here. It's something I've always wanted to get checked, but just never really had the opportunity to do it so easily. The lung test was very easy. It was quite simple. Just had to blow into a tube as hard as I can. The results came out fine, and as far as I can tell, I'm about as healthy as someone my age should be. I think this is an excellent idea. I mean, I wouldn't normally go to my GP and ask for a test because I have no real reason to be concerned, but to have it done so easily so I can just sort of walk past is excellent.
If you want further information, I would suggest you go to the BLF's website, which is lunguk.org, or ring our helpline, which is 08 458 505020.